questions. All right, why don't we start off? Could each panelist just introduce herself and kind of what specialty you're in and that?
I'm Katie Stiles. I'm one of the anesthesiologists and mainly work downtown at our main campus and sometimes outside at our ambulatory surgery centers. I am also an assistant director, so currently working with the M2 class this year.
I can jump in next. I'm Carrie Francis. I'm an otolaryngologist and director of the Oral Society. I'm an associate professor in our department, and I split my time between KU and Children's Mercy Hospital.
I can go next. My name is Maha Fox. I'm the fellow in the Department of Otolaryngology as well, specifically focusing on rhinology and skull-based surgery. I'm just here for the year, and I'm excited to be at this panel and learn from the others here, as well as contribute. I did my residency training in Houston at Baylor College of Medicine.
I can go next. I'm Erin Hecker. I'm obstetrics and gynecology, one of the assistant professors. I also am an assistant director in Kate's Society, so currently working with both M1 and M2 classes. I am actually in the lecture hall now from doing PBL earlier, so.
All right, so I guess that leaves me. I am Stephanie Berry. I am the trauma medical director and the director for the Surgical Critical Care Fellowship. I'm an associate professor. I teach CBCLs, and I'm also the faculty sponsor for the Association of Women Surgeons student group, so I have quite a lot of involvement with the students. I'm super proud of you guys for putting on this Women's Week in conjunction with the other groups. I think it's AMWA and the OB-GYN student group, so you guys are rocking it. Kudos.
And Dr. Vowalk will not be able to make today. She had a conflicting grant meeting, but she sends her love. And if Lisa's able to put her TED Talk into the chat link, she had a TED Talk on kind of women's health, mental health, imposter syndrome. So, but we will get started. So the first question is kind of a general one, and you guys can take it how you want. But for you personally, what does it mean to be a woman in medicine?
I'll take it. Full disclosure, it never really occurred to me that being a woman in medicine was different than being a man in medicine until the idea of sexism in medicine became more of a kind of a hot topic. I always knew that I was going to have to work harder, but that was not like a new thing to me. So I guess for me, it's always just been, I knew that I wanted to go into medicine, and I never really thought of it until more recently. And at this point, what it really means to me is that I have a very big responsibility in ensuring the pathway for the people who come after me and making sure that it's better than it was when I got here.
I had a little bit of a different perspective than Dr. Berry, just in my journey. And so I always carried with me the fact that I was a woman, as well as the fact that I am a Black woman in the journey. And so, you know, for me, it started a little bit with not having woman mentors, not having Black woman mentors when I made my decision to go into otolaryngology, and then recognizing and understanding that process and how it impacted me perhaps during my training periods. And this is just in medicine. I think that I carried that with me through all the aspects of my life as well. And so while I navigated that well, knowing the challenges that I was up against, and in some ways still are up against, and having to work harder, as Dr. Berry said, thinking that I have to work harder. What I have learned up to this point is simply that I have to carry every bit of me with me. And rather than trying to navigate around that spectrum, I rather try to lead from within and bring all of that with me and require anyone who is in my space to navigate me.
I think that I kind of had a similar experience to what Dr. Berry was talking about of in high school and undergrad, and I never thought twice about being a woman going into medicine. I think in medical school is when I kind of started to think about the fact that, oh, there might be some differences, and also like coming up with us, having lectures on sexism in medicine and everything, and then realizing that it may actually, being a woman is a newer thing for being a physician in medicine. I also find that because I'm very, very sensitive now, especially to women and their not only just opportunities in careers and disparities, but also because I work in women's health and that's all I do all day long. 99.9% of my patients are women, and I see healthcare disparities, whether that's in maternal mortality or whether that's in access to reproductive medicine for patients. And so I think that as time has gone on, I've actually found that I am much more cognizant of being a woman in medicine and its importance, and making sure that I'm a good example, and making sure that I'm understanding the the disparities that not only other physicians are having, but also my patients as well. And so I think as time has gone on, I've become much more attuned to those things, and I'm really grateful. And I think a lot of it happens to be my chosen specialty too.
Yeah, I think I'd echo a lot of that, and also applaud all of you for kind of being involved in these issues now, and Betsy for planning a lot of this week to become an advocate for yourselves earlier on in your career, in your training. I'm not sure that a lot of these issues or disparities between men and women in medicine came to light for me until I had my real job, um, and maybe started having my kids, that I really saw some of these issues that come up. So I think it's important that you guys are involved in things like this early on and become good advocates for yourself, and think and reflect on what it means to you at all stages of your training to be a woman in medicine.
I would echo a lot of what everyone else said. I think, growing up in a family that had two girls, and we were always encouraged to sort of do what we wanted to do, pursue our dreams, and be our best selves. And that was a really great environment to grow up in. And I feel like my educators and mentors that I had throughout high school, college, and my residency training were very supportive and never really made me feel any different than any of the boys. And I think that was a really good thing for me. But again, I've sort of become more aware of this last couple of years. And as I kind of grow in my career, I want to make sure I'm advocating for other females to get the same sort of opportunities that I was fortunate to have.
Yeah, so a couple of you guys mentioned having mentors, whether they're female or male, women or men, and AWS focuses a lot on finding your woman surgeon mentor. And so we were just wondering, on your journey through medicine, were any of your mentors women, and how important would it what was it to you to find a woman mentor, or how would that have impacted you having a mentor of the same gender?
I'll go first again. I think that as I reflect and hear everybody else talking about their journeys and their experiences, I think my first mentor was probably my mother. And I say that because she's always been the person who has taught me that that my opinion matters, and that if I grew up never depend on a man. The only man you can trust is your daddy. Like all of these horrible, probably not really great things that have made things challenging in my personal life, but have helped me significantly, I think, in my professional life, because I was always determined that it was going to be on me to be successful, and that it wasn't going to be anybody else's responsibility. In addition to that, she was always my biggest cheerleader, telling me you can do anything you want to do. I remember when I wanted to play football in the 7th grade, and they told me that I couldn't because they needed to order special pads, and I couldn't understand. There's still no reason that I would have needed special pads. I'm still waiting for that to happen, maybe someday when I get older. But she was always there for me to advocate, to say, absolutely, if these are truly the things that you want to do, you can do them. And so I think she was probably my first real female mentor. But I can tell you unequivocally that the reason that I'm where I am today is largely because I had excellent male sponsorship. And, when you choose a field that is predominantly male, the odds of you finding a mentor that looks like you just goes down, just from the numbers, if for nothing else. And so I've had really great mentorship from men. I've also had some really excellent examples as women, and some of that was peer mentorship. 4 of my 6 co-residents were female, and we were a formidable force, and we made changes within that program, I think, just because we existed, and the 4 of the 6 of us being there together. And so, I think that looking for a mentor that looks like you is an important piece, but I don't think that it is paramount. I think that you can absolutely achieve your goals by finding the right mentors at the right time for different things.
I completely agree with Dr. Berry. I think that mentorship should be broad, and it should be expansive, and mentorship should be based on your needs. And some mentors are career life mentors, some mentors are research mentors, some mentors are I need to make it through residency mentors. Some mentors are, I need to get through this rotation mentors. And many of them are peers, and some of them are senior. And I've learned and had mentorship, I would say, from folks who are junior than me. And so it comes in all shapes and sizes. I think it's, as Dr. Berry said, because of the numbers that we have in many of our surgical specialties and subspecialties, do not represent women and the intersections of women that exist in society. You may have more men mentors. You may be fortunate to be in a place where the majority of folks you interact with are women and have them as mentors. And so I wouldn't say close doors to folks who are not women mentors. And I don't think anyone would ever tell you that. I just want to really hit home the point that you should have multiple mentors. And in the fact that you have multiple mentors, some will be, most perhaps will be men, some will be women, but look beyond, look as far and wide as you can to meet your needs. I think one of the biggest mistakes folks make with mentorship is really not identifying their own needs before reaching out to a mentor. And so that's really where I would start. And then seeking out advice and seeking out that relationship and cultivating that relationship as best you can.
I would say even to the extreme of looking outside of medicine sometimes for some of your mentors. I have some great friends who have been able to mentor me through things that I didn't realize I needed until I was looking at it in retrospect. The other thing that I would say about that is that I have never gone up to someone and said, hey, will you be my mentor? Not that I'm not saying that that's wrong, because I think there are some times when that is the appropriate approach. But so many of these relationships, because that's what mentorship is really about, is about relationships. They just happen organically. And you end up finding someone who you can talk to and who can relate to you. And I think that that's an important piece of it as well.
I agree with everything that was. I would just add that I think as being a young trainee, I was a little bit hesitant to reach out to people and ask the questions that I wanted to ask, because I was scared of asking a stupid question or asking something that would be looked upon unfavorably from a training perspective. People would think that I was, not strong enough to make it or things like that. And I think that if you have that question, then probably somebody else also has that question. And just don't be afraid to reach out to people. And you'll have people throughout your training that will make themselves a little bit more available, and take advantage of that when you see those opportunities, and don't be afraid to ask stupid questions. I mean, just today there was something that I asked Dr. Wolbach, and I was like, well, maybe this is a dumb question, but I'm going to ask it anyway. And I got some really great advice from her. So don't be afraid to reach out to the people that are around you.
If you ask me now who my mentors are, for the most part, they're all female, but I also work in 90% of a department of females. And so, and I'm a little more junior faculty. And so most of my mentors are females now. But when I think about medical school and undergrad, most of my mentors were males. And I think some of that, was just because of my interests and who I tended to, or who I just identified as a good mentor in those areas. And so probably wasn't until residency that I really identified most of my mentors as females. And I definitely have no regrets about having mostly male mentors before then or anything. I just think it's great to have probably, yes, during medical school or when I was like having a baby, my mentor wasn't a male for that part. And I had a lot of older medical student friends who had done that and stuff. And so in that point, that was probably when I first started having a lot of female mentors for mom advice and navigating med school and residency in that aspect. But mentors come in lots of different shapes, sizes, and sexes. So.
All right, so we have a list of questions, but we kind of wanted to take a moment and open it to the group. If anyone had any questions, you can either, oh, there's the lights, unmute your mic, or you can chat, or if you want to be anonymous, you can chat directly to me.
I have a quick question off of kind of what we were just talking. It's a little more specific to Dr. Hecker. Since I'm looking at OB-GYN, because I'm interested in GYN-ONC, I've gotten some kind of mixed feedback on people being a little judgy of going into OB-GYN since it is female dominated, and kind of like having a negative connotation of like, oh, you're going in because you're a girl, right? Like that's why you're interested. So how do you navigate that? Or maybe it's just me, like maybe I just have bad friends. How do you navigate that when people make comments about going into something based off of your gender and not because it's something I'm really passionate about?
I think that's their problem for the most part. That's, an assumption that is incorrect. I hope that no matter the sex of whoever and gender of whoever is interviewing in my program, is there because they care about reproductive health. But in general, I think that you just have to, show that what you're interested in and why you're interested in it is because you want to improve women's health outcomes. You want to improve medicine. You want to continue research and improve, and excel towards better things. I don't think that that's interesting. That's actually not something that in general I've heard. It's usually the opposite way of like, of there being a lot of sexism for males going into obstetrics and gynecology. That is not something that like as a assistant program director, that like on the interview trail, that is something, but I guess as you're navigating it through your clerkships, or if you have anybody make those kind of comments to you, I mean, I think that number one, they're wrong. Gynecology oncologists are really badass surgeons who are amazing, and your comment should be, I want to be a really well-trained surgeon, and that's why I want to go into this, and have your reasoning for why you're going into it. But you don't have to justify that to anybody but yourself. There is no reason you have to justify that. It may be uncomfortable. It may, make you sad or something, but you have no one to justify that to but yourself.
Thank you. I appreciate it.
I have a question for the panel. So I'm a fourth-year medical student and going into general surgery and getting ready to start the interview trail. And I was wondering, so I'm also a mom. So I was wondering how you guys, if you would have any advice on how to approach questions about like motherhood or being a woman, especially like in a surgical specialty, if they come up.
I'm just going to put on assistant program director hat. You should not get any of those questions on the interview trail. And if you do, errors should be notified, but it may come up in resident discussions and something, but from the actual interview, unless you bring it up, it should not be brought up.
Can everybody hear me?
Yep.
Yes.
Oh, okay, perfect. Just making sure. Sorry, I'm running around with my phone between cases. So when the tricky question that I got during interviewing that is not directly that, but it kind of, I don't know, hints at that, is where do you see yourself in 5 to 10 years? Which is kind of, I think, a tricky way for them to try and parse that out. Like, oh, I see myself, settled down with a family or something. But my advice is just keep yourself super focused on talking about career and profession instead of talking about that, because they shouldn't ask you direct questions about your family plans.
And another comment, I think that even if it doesn't come up directly, asking, do you have kids? Are you going to have kids? Are you going to have more? Some of your skills as being both a medical student and a mom, you have developed probably superior time management skills, multitasking, and you've proven yourself to still be able to excel in medical school. So I think those are all things that work to your advantage in residency and succeeding in residency.
Yeah, I definitely think that you don't have to, like, you shouldn't, if you want to talk about it, it may come up, like people wear wedding rings, like we know these things about people. Somebody may mention it in their like personal statement or something, or if hobbies, it's often playing with my kids or something, and so as long as you feel comfortable talking about it, like Dr. Stiles said, you should use that for your advantage. I personally probably have very much an unconscious bias that my moms are probably really great at time management, and I take that into, try not to take that into account, but I definitely am thinking, oh, they know how to multitask. Great. So.
Thank you, guys.
I think it's a great question, but full stop, it's against the rules for them to ask you that kind of thing if you don't bring it up. So if that happens and you did not bring it up, you have no reason to not report it. And if it's somehow you get a vibe that it is viewed in a negative light, that is not the place for you. They are on interview just as much as you are, as far as presenting a program that works for you. So if it's not a comfortable place for you, if it's a, if it's a square peg in a round hole and it's not going to work, then you can just mark that one off my list of who I want to rank, because you don't have to tolerate that type of nonsense.
I'm going to chime in a little bit too, just piggybacking. I feel like I'm piggybacking off of Dr. Berry this entire time, who always has great comments. I agree, and I don't have children. In mentorship and coaching in other ways, I have heard successful strategies, and I agree with both Dr. Berry and Dr. Hecker as well, as far as the fact that you should not be asked that. I would also encourage you to have a response, because should not be asked and you're asked anyway can happen. And it is difficult to report, and not always, and people don't always feel safe reporting. And so I appreciate that. And I know everyone on the panel appreciates that as well. And so when I mentor and coach through uncomfortable situations, particularly on the interview trail, fellowship, residency, and just in any interview that you can be on, I think it is useful to come up with a response that you have practiced it, and you can use it in an interview setting if something like that does come up. Because one, it shouldn't be asked, but two, it could happen. And three, you want to be able to be prepared to advocate for yourself. And it doesn't have to be a long statement. It could be something as simple as, I don't feel comfortable speaking about my family plans in this environment, or something else. But that way you have it in your back pocket and can share it if something like that does come up. And then here's another opportunity where you utilize your mentors as well. So if not sharing and reporting, share and work through that with your coaches and your mentors.
Yeah, it will sometimes come up. I mean, I was asked that at my medical school interview at the University of Kansas that I ended up attending. So I was asked in medical school how I thought I would be able to be a physician and a mother. First of all, it was super presumptuous, because at 22, I wasn't even sure I wanted to be a mother. So the question really caught me off guard. And so I agree with Dr. Francis that having an answer that you're comfortable with is an important piece, because my sarcastic women have been doing twice the amount of work for half the credit for decades. May or may not be the right answer at the time, but it was the only thing I could think of because I was unprepared for it.
But it was the correct answer.
Thank you, guys. That was really good insight.
It was the truth.
I was just kind of wanting to bounce off that. So for those who have had kids and have done it, or they themselves have been pregnant, were you like pregnant during like residency or medical school? And like, how was that? Were you perceived different? Were you treated different when you were pregnant? And kind of just on that kind of tangent.
Well, I had a baby in medical school, one in residency and one as an attending. So I guess I've done it all a little bit. But medical school, I think I was really, really worried about having a baby in medical school, about when to, my best friend who was 2 years older than me in medical school had hers at the end of fourth year, which seemed like a great time. And then I ended up having one in fourth year a little bit earlier, and that was fine. And I don't think anything was different. I mean, fourth year is a special time in your life. So it was nice because I definitely wasn't overworked during that time. So that was really nice. And I don't think I had anything was necessarily different. I mean, definitely breastfeeding and pumping as a medical student. I was a lot more like shy or nervous about necessarily like asking time, but really in general, I didn't have any issues. I have had a student or one of my friends in medical school who was my age, and in our second year, she had a baby, and I always remember her like pumping in a bathroom all the time, and I definitely never had to do that as a fourth year, which was nice. I think I was just very open about it and needing to pump, and everyone was, I again wasn't on a lot of hard rotations during that time frame towards the end. Residency, I mean, again, obstetrics and gynecology, so there's a lot of it's you're kind of expected to have a baby but work hard as everyone else. I don't but I do think there's a little bit of an understanding in my profession, but there's also like we understand pregnancy, and we know you can work up until the second you have that baby. So, most of us would go into labor while we're working or something, so, but it was nice to always, I always felt comfortable that I was going to have a baby in a safe place. So that was nice. And then, but I don't necessarily, I wasn't treated differently, literally. Residency is pretty challenging, and especially if you go into a surgical field, so there wasn't a lot of, I came back to my gynonc rotation, and I worked 80 hours the second I was back from maternity leave, but I was in a specialty where pumping was, you pump anywhere. So, which is nice now that that's much more normalized, and even our GME, you have the ability to get like a hands-free breast pump through them and everything, which is a great initiative. I thought having a baby as an attending would be easier, and it wasn't. It was just the same. So.
Yeah, so I have 4 kids. I had my 2 kids in residency, and was pregnant throughout my fellowship, and then 2 kids as an attending. I think having my first as a first year resident was probably the most challenging, because I was with a bunch of people I didn't know very well. So I just wanted to work and not ask for anything, and just worked up until, probably 12 hours before I delivered, because I didn't want to seem like I couldn't not do anything. And then coming, back then, we really didn't have any maternity leave policy. So I kind of begged and borrowed some days, and, got 5 weeks off. Looking back, I may have wished I would have, somehow found a way for more time, or found a way to have a better leave. But the second baby in residency was easier, having known everyone in the department longer, known my co-residents longer. But those would be my thoughts. I'm not sure I was treated any differently. And where I did my fellowship when I was pregnant, actually, that environment there at that children's hospital, everyone, went out of their way to make sure I was comfortable and doing well. So I think it's probably just very dependent on where you're at and the culture of the department that you're in.
I did not have children in medical school or residency. I waited until I was had my first real job. That had nothing to do with the environment where I was, short of the fact that I knew I didn't want to live in Michigan forever, and I was training in Michigan. And so my interest in having significant relationships with members of the opposite sex where I might have a baby were limited. I just wasn't going to get involved, because I knew I didn't want to be there. And so my choice was to wait, but not because there was some discouragement. One of my co-residents, again, 4 of the 6 of us were women. My co-resident Aisha, she had a baby while we were residents. I suppose she may have a different recollection of how she was treated. I don't even recall her missing a day. I know that she was out for maternity leave, but it was never, we were never like mad. We were never, oh, I can't believe she gets this much time off. Oh, we have to take all this extra call. I mean, none of that kind of thing happened within our group. We were all excited for her and happy for her. And, you know, she went to her appointments and did her thing, and we never were the wiser to it. I think that your family planning really needs to be based on you. And this idea that there's a right time in residency or beyond is false. It will be the hardest thing that you ever do, regardless of when you do it. And so it really just has to be a time when you feel like it's the right time for you, and not based on your training program. The other thing I would suggest is to also know what the rules are. So there may or may not be a maternity leave policy within your residency program, wherever it is you decide to go. But then above and beyond that, there's the ACGME rules, and you're allowed to take the 12 weeks that everybody else takes. It just may mean that you extend the length of your residency program, because there are rules around how many weeks you're required to be clinical to complete your training. And I know that there are pushes to go away from that and to go to competency-based training and those sorts of things. And so that may change as time goes on. So I think the other important thing is to just know what is available to you and what the rules actually are, both within your program itself and then within the governing bodies that govern the programs.
So you guys kind of mentioned about like how maybe you should have advocated for yourself more or something like that, but I was just kind of wondering some advice of like, now that you guys are where you are now, like what is some advice on how to like advocate for yourself or make sure like you like know your worth and make sure you get what you actually need?
I'll start off in responding to that question. And I think that's a great question. And it is definitely part of the evolution of your identity as a physician as you go through this process of medical school and residency and fellowship and even beyond. I think the answer starts with self-reflection and internal work, and there's really no way around that. Sitting down and, you know, asking yourself questions about yourself, asking yourself questions about what you want and who you are. And I believe that that's a very hard concept, I think, for a lot of go-getters like there tend to be in medicine and many health professions to really sit with, because it doesn't seem very scientific. But you know, I will say that I do believe that it is the way that we keep ourselves whole, and we can only provide great care for patients when we're whole, not when we are trying to live two lives and do two separate things. That is one of the keys to burnout. So the answer starts with a lot of self-reflection, sitting in the situations you're in, acknowledging your feelings, your fears, your guilt, your discomfort, all of the things that you have, and then utilizing facts, what you need to do to get through the next stage of your life. I would also recommend really thinking about what you want and setting goals for yourself, and realizing that medical training is composed of a slew of external goals. Your entire medical school career, your entire residency career is based on someone telling you what you have done and that you are now ready to go to the next place or do the next step or do a certain procedure. There are a lot of external goals that we have built medicine upon, and that really creates an environment where you shrink yourself. And when you shrink yourself, it's really difficult to then advocate for yourself at the same time. So unlearning that process can be difficult. So what I would really encourage you to try and do is to start developing skills, because all of this is a journey and a practice. It's not something that you complete tomorrow. There's always going to be another part of that journey. But you have, what I would recommend is really learning how to develop goals for yourself, and recognizing that those may be in line with the external goals that medical school, clerkship, residency, faculty have placed upon you, and recognizing that sometimes they'll be aligned at times and they won't be aligned at times. And you have to figure out how to prioritize and what goals that you are going to accomplish at what time. But just remember that medicine is very external. The training is very external. Someone else is telling you something about yourself. And there isn't a lot of the educational process, the med ed process and residency training that really helps you develop yourself and self-reflection and that ability to really be authentic and use that authenticity to be successful. And so I hope that medicine, the med ed journey and practice changes over time, but that transformation is going to take a while. And so finding great peer mentors, finding great senior, junior mentors can help with that. But a lot of it revolves around internal reflection.
I think that was great. I don't have much more to add to that, other than in this past year have been working with a mentor at an outside institution, and one of her good pieces of advice to me when we first started working together was to kind of keep a piece of paper at your desk or a little notebook at your desk and just kind of take notice throughout your days and weeks, kind of what are the things in your day that make you happy, make you excited to be where you're at, make you passionate, and just kind of take notice of those little things, because those are probably the things that you can turn into your goals and turn into the work you want to do outside of the work that is given to you by the medical school curriculum or your residency curriculum. So just kind of pay attention to those things that make you make you happy, and make you excited to be doing what you're doing.
I think it all comes down to your why. Why did you choose what it is you're going to do? And if you can always bring whatever it is back to your why, then you're going to be happy with it. I love what Dr. Francis says about everything being external. I'm in a strange place in my career because I'm finally at the end of the carrots. And I'm internally, personally been working on these reflection things that she's talking about, because I'm at this point where, so you're in college and the next goal is to get into medical school, and then you get into medical school and now you have to get a residency program, and now you're finishing residency and you get a fellowship program, and you finish fellowship and you get a real job, and then you get a real job and you get a leadership program, you get a leadership position. And then what? Somebody else has always been telling you that these are the next things that will make you successful. And then you get to that point and then you're like, okay, who's going to tell me what to do next? And is it okay to just be in this place for a little while? Do I always have to be striving for that next carrot, or can I just actually enjoy what I'm doing for a little while? And it's not that I didn't have fun at those places, right? I enjoyed all those things. We always talk about, oh, when I was a resident this, and we had so much fun when we did that. And so it's not that you don't enjoy the ride along the way, but I think you look back and you kind of realize, someone was always kind of leading me down the path where I was supposed to go. And now I'm in this place, and what is the path that I want for myself? And I think it's really easy to lose sight of those things during your training. And I think that's what she's talking about when she talks about make sure you're doing that self-reflection along the way. And am I still going down a road that I really want to be on? And I think that the advice of writing down the little things and making sure you know what they are is really smart, because it doesn't have to be within medicine. It can be things that are outside of medicine that you really love doing. And if you lose sight of those things when you're in training, it'll be really hard to pick them up when you're finished, because you're always like, oh, I'll get to that when. When never comes. You have to make when happen. And so you have to really be focused on the things that really matter to you. And sometimes those are clinical, sometimes those are research goals, sometimes those are personal goals. And there will be phases in your life. And there will be times when you're all in and all you can think of is medicine. And there'll be times when all you can think of is, your family. Or there will be times when all you can think of is this super cool hobby that you love to do, and all of those things are okay. You just have to really be mindful of the things that matter to you, and don't get caught up in what someone else is telling you is the right thing all the time.
Looks like we got a question in the chat that's related to this. It seems that women in medicine are more prone to burnout. Have any of you struggled with this? Do you have any advice on how to avoid or get through a burnout?
Maha, you're on mute, but you came up on my screen. Were you going to speak? I didn't want to talk over you.
Sorry, just for the last question, sorry, I was having some technical issues. I was just going to say, in terms of advocating for yourself, I think we've kind of circled around the idea of feeling a little bit uncomfortable. I think you have to, in order to change things, sometimes you have to be willing to have those uncomfortable conversations with people that are going to result in the change that you want. And so when you're talking about advocating for yourself, don't be afraid to get a little bit uncomfortable and make the other person uncomfortable, to recognize that you're not getting what you need out of this relationship or this training program, or a social experience or a clinical experience or whatever that might be. So sometimes advocating for yourself can be uncomfortable, but be respectful about it, and be focused on what your priorities are and what you want to get out of that experience, and be vocal about it, because otherwise it's going to result in a lot of dissatisfaction. And just as an example, like as I'm looking for jobs, I'm trying to be very mindful of things that Dr. Berry was talking about. What are the things that really bring me joy, and what are the things that are going to make me happy, and what are my top 3 priorities in terms of what I want in a job, and what are the other things I want to negotiate about. And as I'm having these conversations, I'm kind of trying to keep those priorities in mind, but also be willing to have a little bit of that uncomfortable conversation of, I'm not really happy with what you're giving me in this particular domain that is a high priority for me. So don't be afraid to make yourself a little bit uncomfortable, and people just slightly uncomfortable, to have that conversation.
I'll also add to, I think, Jasmine's question in the chat about burnout and advice on that. And really circles back to what I mentioned before and what Dr. Berry mentioned. At some point, there is going to be no one telling you what to do. And if you have not figured out what it is that brings you joy or what you're passionate about, then you will spend time living someone else's career. You will be living the career. I'm going to use my chairman, Dr. Chu, just as an example for a name. But, if I didn't have my own vision and or my own purpose, perhaps I'm doing research that I don't want to do. Perhaps I'm going down a path of becoming a department chair, which I don't want to do. And so that is one of the things that can lead to burnout if you are not doing what you want to do in the way that you want to do it. And it is very easy, especially for junior faculty, to fall into that trap, junior and even mid faculty. And some people, unfortunately, spend their whole careers doing that, because you are at a point where no one is telling you what to do. And it's very easy to get sucked into what other people want you to do, because you're junior and because it doesn't feel comfortable. So I would really encourage you to start practicing identifying your strengths, your purpose, your goals, and how you can reach those. It may look different because you don't have the same amount of time and or the same authority, but it's a skill that you want to gain now, because if you spend the next medical school is 4, let's say you're doing a 4 or 5 year residency, maybe a fellowship year. If you spend the next 9 years of your life only living by what other people have placed upon you, it is going to be very difficult to get out of that. And that is one of the things that leads to burnout. You're doing something you don't want to do. I mean, how often do we procrastinate when we have to do something that we don't want to do? The laundry piles up, or the manuscript never gets written. And you ask yourself, is the laundry piling up because I don't want to do the laundry? Is the manuscript not being written because this is actually not something I care about but got pulled into? So you want to practice those habits now, and you want to gain those skills and being able to advocate for yourself. And that sounds scary, but also perhaps think about it as advocating for your purpose. And if your purpose is service in a particular area, you're advocating for patients. Sometimes we do have to trick ourselves into doing what we need to benefit us. And so whatever way you can do that, leaning on those skills of living your best life and being the best version of yourself, that is how you'll be successful. And that is how you can acknowledge, recognize, and reframe if you begin to experience burnout.
I think another important piece to avoiding burnout is really having realistic expectations. We get this, we're getting it from all angles, and we're watching J-Lo and we're watching Heidi Klum, and they have it all. I promise you that they have the same struggles you do. They're just not putting it on their Instagram. And that they have someone that's, you know, doing the things they don't like to do. I obviously didn't do this as a resident because I was super broke, and then I was even less wealthy as a fellow. But I don't mow my lawn, and I don't do my laundry. Praise Jesus that my husband likes to do the laundry, because I haven't done laundry in 9 glorious years, and it's a beautiful thing. When you can, you outsource the things that don't bring you joy, because it's worth it in the long run. I fought for years hiring someone to clean my house, because I grew up in a you know, blue collar family, and you didn't pay people to do things you were physically capable of doing. It's been the best thing I've ever done. I've only had it for about 6 to 8 months. Well, not that 6 to 8 months before COVID, and then it stopped for a little while, and I remembered exactly why we did it in the first place. But it's important to find the things that bring you joy, and then actually realize the things that don't, and don't try to make yourself do all of those things. And it's not that you're not ever going to have to do things you don't like doing. Don't get me wrong. There are still plenty of things you have to do you don't like to do. But when you find the things that you don't enjoy that you can give to someone else, it's okay to do that. And no one can tell you that it's not, except for you. I had this guilt on my shoulders of, you know, from my childhood of, you shouldn't do that, it's not right. It's amazing. I worked really hard to get here, and I work a lot more hours than my mother did when I was a kid. And she, you know, because she was able to do all of those things, but she didn't work overnights, and she didn't work holidays, and she didn't work weekends. And so I don't have to feel bad about the choices that I make, that of how I'm going to structure things for myself. So I think it's important to figure out what are those things that you really don't like to do. And once you get to a point where you don't have to do them anymore, it's okay to say, I'm not going to do that anymore, in your personal life as well as your professional life. I think when we're young faculty, we think that, oh, so-and-so offered me this committee and I have to say yes. I have to say yes. I have to say yes. I'm currently in the process of getting off of like 80% of the committees that I said yes to originally, because they are not the committees that I care about. There are things within the health system that I care deeply about, and I want to be involved in those things. But the more I said yes to the things I didn't care about, the less time I had to spend on the things I do. And so you have to then realize which are the things that really matter to me, and get comfortable saying no to people that you're worried you're going to disappoint. Because in order for you to maintain your sanity, you have to be willing to do that.
And I think some of that is hard as medical students and physicians. You know, everyone in this is high achieving, competitive, you know, wants to be the best at what they're doing. So you have learned to say, yes, I'll do it. It'll be good. It'll be on my resume. Then it'll be on my CV. And I think I have, you know, it is a process to kind of unlearn some of that, and focus on, again, what you are passionate about, and it will seem like less work. And I think then you also create, you know, you do need to learn how to create some boundaries between what you need to do for work and your job and your career, but also boundaries for what you need to do for yourself outside of your work and your career. But some of that stuff is hard to unlearn.
Yes, I wish someone had told me that I could say no earlier in my career. So I'm telling you now, it's okay to say no. I think we think that if we say no to things that we're not passionate about, that then we won't get the offers for the things that we are. And that's not true. You have to do a really good job at things. And when you're not passionate about something, you're not going to do a really great job at it. So measuring that and selectively saying yes. It's not to say no to everything, but it's say selectively yes to the things you actually care about.
It's really difficult, as was said, to do that at your stage in medical school and even in residency as well. It can be difficult. But here's the thing, this is where you also utilize your mentors, okay? I can't say that enough. You don't utilize your mentors when you're on 8 committees and when you have committed to 5 research projects that you don't actually want to be a part of and are being asked to do something else. You know, when you are thinking about the no's, the selective no's, like Dr. Berry, like Dr. Stiles said, we recognize that it can be difficult at times. At this stage, you may not feel like you can actually say no, but this is a perfect opportunity to have a conversation, to reach out. So utilize your mentors, and when you get your mentors. And these types of conversations are what help you cultivate the mentor-mentee relationship. So we've kind of come full circle to that, but I think it's important to remind you of it.
The last thing I'll say on burnout, because I know we're running out of time, pick something you genuinely love to do, because it doesn't matter if your job is to be the greeter at Walmart. If you don't truly love what you're doing, if you have to do it for 40 hours a week, it's going to be a drag and you will burn out. So don't pick something because of any other reason than the fact that you genuinely, truly love what you do. It doesn't mean that you won't have hard days, because all of us are going to have hard days in whatever career it is that you choose. But when you choose, it's really got to be something you love, because you will spend the majority of your time doing that. The majority of your waking hours, regardless of what career you choose, will be at your career. The other thing that I will say is choose your partner in life wisely. If they don't support you, if they are jealous of whatever it is that you're accomplishing, if they are intimidated by it, it will not work long term, because they have to be supportive of what it is that your dreams are. And it's probably the most important decision you make, secondary to which career you choose.
Okay, so we are about that time. Just if any of the panelists had anything last they wanted to say before we wrap it up, but this has been really insightful and I really appreciate your all's time.
Thank you for inviting us, and thank you for putting this panel together.
Yeah, thanks, Betsy.
Yeah,
Yeah,
thank you.
I'm proud of you guys. Oh, sorry, Maha.
All right, thank you guys so much. Really appreciate it. And for those doing the paint and sip tomorrow, we'll see you then. But thank you guys so much. Thank you, panelists.